go check it out at PriceEcBootcamp.com or thehippabootcamp.com. Or there's a link on our website. And if there's not one, David will make sure there is by the time this is published.
That's right. That's right, Krista.
You're listening to the Help Me with HIPAA podcast, where HIPAA and humor collide to make learning fun. Your delightful hosts are Donna Grindle and David Sims. Relax. HIPAA help is on the way.
Welcome to episode 442 of the Help Me with HIPAA podcast. My name is David Sims of HIPAA for MSPs, and joining me is Donna Grindle of Cardin. What's up, Donna?
I'm up.
You back in the saddle? Back in the States?
I was at the southernmost point, and now I'm back in, where it will be frigid in soon. We've got another system coming through, and I was going, I need to go back where it's warm and there are palm trees. I do so much better there.
Probably closer to Cuba than you were South Carolina.
Oh, absolutely. Yeah, you're they always talk about it. You're literally closer to Cuba there than you are the rest of the United States. So.
I know. Yeah, well, good to have you back.
I never left.
I was going to say, you don't have to say I'm glad to be back, but it's good to have you back. Oh, man. So today we're going to be talking about the new New York, because now you got New York.
Yeah. That's going to cause a stumble soon, I'm sure.
I know. But they've got the state attorney general has some interesting things going on.
Yes. Yes,
there's
they do.
HIPAA enforcement happening, and then the governor has thrown some interesting things into the mix about their very own cybersecurity incentives, I guess we'll call it, for hospital systems.
Okay, you can call it incentives. All they're saying is, here's the regs, and we put some money to help you. I don't think that's an incentive.
It's I don't know, 500 million reasons.
I know. Do it now while you're getting some help.
Yeah, that's true. So if you're in New York or have clients in New York, then you might want to pay attention, because there's some things you might ought to know. And then, of course, we got some other hair-raising things to cover.
Yeah, but even if you're not in New York, you need to pay attention, David.
That's true, but more so if you are.
Yeah.
But here's the thing is, if you're not in New York, oftentimes we do see things that are in these more prominent states like New York and California end up propagating to other states.
Yes,
So,
in fact, they say nation leading. That means others will follow.
Right. So for me, being in the South, it would benefit me to go ahead and look at what they're doing and say, hey, you know what? Even though I'm not in New York, I'll start following these types of regulations so that if and when they come to my state, I'm already ahead of the game.
I got a plan. I don't have to do them, but I better know how and when. That's it.
Not only that, but I literally could get a call tomorrow from somebody in New York that says, we'd love to do business with you. And then I'm all of a sudden now, all these regulations now apply to me.
Yep. Suddenly, yeah, because vendors matter. So it doesn't matter who you are, it matters. So there.
It doesn't matter who you are, it just matters what you do. Or sometimes it matters what you don't do, which we'll cover that in a little bit.
Yes.
Do want to say thanks to those who are listening and watching us on YouTube.
I know.
I did find out that if you have ad blocking on YouTube now, they decide to show you longer commercials.
Really?
Yeah, like very long commercials. So,
brutal.
Normally you get hit with like the 30-second ads. I was getting like 16-minute ads. And I'm like, what is going on? And so I started doing a little bit of research, and they said, yeah, if it picks up that you've got an ad blocker on, they throw this massive ads at you.
And you don't get the little skip button, huh?
No, like you got to go through the whole entire 16-minute commercial so that I can watch my 2-minute video. I was like, wow.
It's a business, man. It's a business.
It is. And I made a business decision not to watch it. So it's like, I don't care that much. But, so now I've got to reevaluate whether or not I have to turn off my ad blocker for certain things. But anyway, that aside, go check us out on YouTube. Subscribe, like the channel. We appreciate that. Also, thanks for those who help keep us on the air with your support, whether that be just listening or sending us donations. Either way, we appreciate it.
Or sharing it or reviewing us. Subscribe somewhere.
Yeah, there's all kind of ways to support us. Matter of fact, go ahead.
There's a phrase, we're slave to the algorithm. I don't know where I heard that, but yeah.
So if you want to support us in a way that brings massive personal benefit, you might want to check out the HIPAA Privacy and Security Bootcamp.
Yeah, because you will get benefit.
Yeah. Yeah. So that's a 3.5 day. And Donna's already talking about how she's not sure how she's going to cram all of it in 3.5 days. And we may have to go to a full week at some point.
Well, used to we could do 2 days. When we started doing this years and years ago, we tried 2 days. Then we're like, it's going to need to go 3. But, based on what we're seeing happening in the world, there's going to be more to cover.
Mm-hmm. Yeah. So now we're at 3.5 days, and we've even talked jokingly before the podcast today that we're going to have like a summer session and a fall session or something like that.
Yeah, I don't know how.
So you'll have to come to both, like a part 1 and part 2. It's just so much involved, and which is to say, it's very comprehensive. It's not your 30-minute HIPAA training. It's not your, quick shot in the arm for cybersecurity awareness training. This is very, very in-depth, comprehensive on how to build a privacy and security program for your organization.
And we use every freaking minute of your time.
Yeah, we do.
You can leave to go sleep, but that's it.
You can sleep.
We get you there with breakfast. We keep you there with lunch. We let you go not for the early bird dinner, I'll tell you that. But we are doing everything we can to get it done as quickly as possible. But every time somebody's like, hey, why don't you do more on this topic or, add this? And we're at the point where we're going to need to add things and bring in more of some topics, which is, everybody else is, what are the password rules? You know what? We barely talk about passwords in this. This is not for let's debate what kind of password rules to have in place. This is, okay, how do we look at the threat landscape and prepare ourselves for attacks and maintain compliance while we're at it?
Yeah, so, a lot involved. And we typically have an OCR investigator there to answer hypothetical questions.
Yes, we would never tell Allison that it was real world. It's always hypothetical. And so we've already got her booked for the meeting. We also have, I think, our friends on the 405D group to be there to explain the HHS part of 405D. I mean, there's plenty of us that'll be there that can explain the private side. They're there to explain the public side of the investment in 405D. So it's stacking up. It's looking good. So
yeah,
go check it out at prisecbootcamp.com or thehippabootcamp.com. Or there's a link on our website. And if there's not one, David will make sure there is by the time this is published.
That's right. That's right, Krista. So yeah, we hope to see you there because it is an absolutely fantastic event. And the only thing I can think of that we have not yet instituted that's been a request over and over again is to start serving alcohol first thing in the morning.
Yeah, we're going to try to do the Bourbon and Breeches Happy Hour, where we take you through a breach story and we teach you about bourbon and pair it, the breach story with the bourbon. I bring them together. Nobody believes it till they see it. But I know, even David's like, I don't know how she's going to do it. I can find a way with most any topic to bring it back in there. But we're also trying to make sure that we have, adequate time for you to meet and talk to others. But then there's, that's like, good luck, because you got 5 minutes right now. Don't keep saying we're going to do it later. So, I've been working on the agenda. It's really packed, but you definitely want to check it out. Oh, and Early Bird, where you save money, ends on February 5th. So get it done. Get her done. And if you're in HIPAA for MSPs or Card and Club, you get a discounted price, but you need the secret code, which you can find by logging into Card and Club and HIPAA for MSPs.
All right. Good deal. I'll be there.
I'll be there.
The other thing I really love about it, and so far we've been able to do this, is we keep it small, on the smaller side. You don't have a 200 person event, because we really want interaction, and we really want you to feel like that you're taking a ton of value away from this. And oftentimes you don't get that when you're in a room of 100 or 200 people. Yeah. So we want this to be something where everybody can be involved, ask the questions, get the answers. We have a lot of conversations. It's not just us up there running our mouth the whole time, but tons of conversations about things that are going on within your own practice or hypothetically of. Mm-hmm. and then we address those.
And it's IT providers, it's lawyers, it's administrators, it's county governments, it's behavioral health, oncology, primary care. I mean, we all of it. So if you are required to build and manage these programs in any way, shape, or form, if you need to understand it, that's what we're there for. No, it's not general workforce training. This is for the people that have to do the work to manage the program, not the general training. So come on down.
Yeah. Yep. And if you're in New York, you might want to go ahead and jump on it too, because you're going to need it. And we'll talk about that in a few minutes.
Yeah.
All right. So let's dive into our HIPAA briefs.
We need some theme music maybe we use the new rap tune as theme music for the HIPAA briefs. Just a little clip, something like that.
All right. Boy, you make it happen. All right. So let's dive into our HIPAA briefs. So the question you've got here, who enforces HIPAA regulations? And it's not the HIPAA police.
No, it's not. I want to talk to the HIPAA. I've gotten those calls before. I want to talk to the HIPAA. Okay, we're going to have to step back just a tish here. There is no HIPAA to talk to. But I'm here. But from a legal perspective, and that's what matters, legally, under the high-tech rule enforcement actions that it added, there was it was just a little bit of enforcement before, and nothing really happened. Now something happens, but there's a lot of pressure on them, and it's been growing for years now to more sternly enforce the regulations. So you got HHS, the Office for Civil Rights under HHS, and I have had people come to me confused because there is an Office for Civil Rights under the Education Department, because that's a whole different thing. So if you just look for OCR and you end up down some rabbit hole about education, it's HHS OCR that you have to know about. And that's who I guess most people would consider the HIPAA police. But in the high-tech rule, it also allowed state's attorney general's office to enforce HIPAA on behalf of their constituents for things that happen in their state. And often that gets overlooked. So this whole thing is going to remind you that it could, any time an attorney general in a state could decide to take this on, and it looks like in New York it's been like set up. I mean, they've got multiple cases, and we're going to hit on a big one, touch on a few more, and then they added in this whole thing. So we're going to start seeing this in other states because it takes, federal government can't get it done. The states are going to start doing it, and that's only going to make it more complicated, in my opinion, because now there's all these different rules. But it's where we are. It's what we're going to need to deal with.
All right, there you go.
Mm-hmm. There's your brief. It's a whitey-tighty today.
All right, so our 405D tip of the week. You want to talk about the 405D post? So
right,
volume XXII.
Yeah.
December 2023.
Mm-hmm. Yeah, there were a few things released in December, and I wanted to make sure that we reminded everybody those come out. The 405D post comes out, I don't remember, every other month. I don't remember how we do them. There's a schedule, and we don't have to worry about what that is. We just show up and write articles, right, David?
That's right.
But in the December version, there is the main article is Building Sustainable Health and Public Health Services with Enhanced Cybersecurity Knowledge and Action. And it was written by Dr. Seiler, who we know as Kendra, who is the lead of Wave 1, which does a lot of the associated products, but they look into different methods in different areas, what she's doing in Florida with ComHit, and we've gotten involved with them in that to provide specific training for technology providers in the state of Florida and certification through the CHMSP program. And they also look at programs in the U.S. Virgin Islands and some other places that are really interesting. And then there's an article on effective policies to mitigate the risk of cyber attacks, specifically pointing out what small entities should prioritize. So that's a really small one. But then we got out a couple of other things, and I can't remember what we've looked at, and I didn't have time to go look it up. If we haven't mentioned it before, I thought we'd throw that in there, David.
Yeah, very good.
So the cyber insurance for small healthcare organizations flyer, it's a one-page bullets. Cyber insurance for medium and large size health organizations. So it's specifically discussing why you care and things to think about.
Go check it out. That'll be at 405d.hhs.gov. You can get all those resources.
Or there's links on the show page, show notes.
Yep. Go check those out too. All right, let's get into the topic. New York has a new state AG HIPAA enforcement that you want to talk about. And then we'll talk about what happened.
What had happened was, and I had to look this up, refua, I think is, I got the pronunciation and everything. Refua Shlema is a Hebrew phrase for like get well soon. And this was with Refua Health Center. And they operate 3 facilities and 5 mobile medical vans within the Hudson Valley. So there you go. We're going to review that plus some of the other stuff that's happening. But there were some interesting things. And right there in the headline, it got my attention right away. Attorney General James reaches agreement with Hudson Valley healthcare provider to invest $1.2 million to protect patient data. It wasn't about a fine or a penalty. It was, we're committing to making an investment in cybersecurity. So that was interesting right away. I went,
Yeah, what? An investment?
Mm-hmm. Well, you need to invest. So this goes back to the health center experienced a ransomware attack, which they, had to report, and that started an investigation by the AG's office. The attack started in May 2021. The original stuff said in May 2021 they had a ransomware attack. No, in May 2021, somebody got in and they launched the ransomware attack June 1st, 2021. And the Lorenz ransomware group claimed that one. I think we even got a HC3 bulletin on that group. And 250,000 residents of New York, their records were exposed. They were exposed. So that meant the AG could take action on behalf of those residents.
Mm-hmm.
So they went in and they said, look, we're going to start asking you a bunch of questions. And I don't know. It seems to me like no matter what state we've seen, and there's been a few that have taken action under this rule. And some of them have done it like together. There was a group of them that did it together when it was the Anthem breach. But these investigations, they're not as friendly as the OCR investigations seem to be. As far as what they're asking for, it must be a lot more detail. I haven't dealt with a specific state AG request, like, all the ones with OCR where we help people figure out either they're already our client and we tell them where the stuff is and help them, gather it all, or they're not our client and we help guide them through, here's what you need to do. So this investigation concluded that attackers were able to access this data because Refua had failed to adopt appropriate data security practices. They failed to decommission inactive user accounts, rotate user account credentials, restrict employees' access to only those resources and data that were necessary for their business functions, use multi-factor authentication, and encrypt patient information. Now, the encryption thing you and I always talk about, but I don't know unless you get into, that's a whole nother thing, but I would argue that needs to be out of there.
Mm-hmm.
So why don't you take us through, because this is particularly interesting from your perspective as to how they got in the first place. So there's a lot of things in here that I'm like, see, I knew it. So,
yeah.
But there's a point where you're going to know that David was, well, you'll know.
So they were able to gain access to the systems using systems that were for viewing video from the internal cameras in the that monitor the facility. So for all those people that are like, oh, we don't worry about the camera systems, that's not part of IT. It's still a security concern, obviously.
Well, and it was protected by a static 4-digit code.
Yeah, which is my next point. So a static 4-digit code. Okay, probably 1, 2, 3, 4. But anyway, it's protected by a static 4-digit code. Not hard to get through, I wouldn't think. But from this system, the attackers were able to then remotely get to the network using login credentials. Here we go. I'm crashing already reading it. For an administrative account that the credentials were stolen during the attack. Now, the administrative credentials that the attackers used to gain access to the systems were from an account from a former IT vendor. All right. Here we go. The credentials had not been changed for at least 11 years because the IT vendor hadn't worked for them since 2014.
Ow. Now, Wait a minute. 2021. So 11 years. That means 2010. No, yeah, 11 years. So 2010, they were working for them, set up the credentials, never changed it until never changed it. But then they stopped working for them in 2014 and no one did anything.
Yeah. So a couple of problems. One, the fact that the IT vendor never changed their credentials, obviously, for years. And then once they were no longer an IT vendor, apparently nobody ever deleted or disabled their account access, administrative account access. No multi-factor authentication was enabled on the account, nothing. Now, I don't know if the server, was that old. It was 11 plus years old, maybe. Or if somebody did a migration to a new server and nobody bothered to say, this would be a great time to review our administrative accounts and such to make sure that, the right people have the right access.
Yeah.
But, it should be, if you are the IT vendor, it should be part of your decommissioning or your offboarding of a client. That should be part of your process. Like, let's remove our access to stuff. And if it's not, then shame on you. But the vendor or the client really should also be going back and saying, let's make sure this happened. Let's make sure that their accounts are gone. Because sometimes it is possible that somebody could say, we have a script that will remove these users, and they run the script and the script reports back it ran, but it didn't or something like that. So it is possible that IT company could say, yes, we do all this through automation, but it just didn't happen for whatever reason. That should be in your checklist when you're taking a vendor away. Did all these things happen? When a new vendor comes on, they check, do all these things happen? Like, we always go through and look at, and oftentimes we can tell how many IT vendors they had because there's credentials left over from every single one of them, which blows my mind. Like, how can we find 3 different IT companies' credentials? Like, nobody else saw it until we came along? But anyway, that aside, make sure that only the people that need access have access. Anytime there's a change in your environment, bringing in IT, firing IT, changing IT, all that stuff needs to be reviewed. You should do another mini risk assessment on those things.
Well, it's not just IT, though. I mean, a lot of vendors get logins to do their job. So you should have a vendor onboarding plan and a vendor offboarding plan. And a BAA agreement basically requires that anyway to get it done properly. So, it's the same kind of checklist as arrivals and departures for employees.
Yeah.
Same kind of concept.
Yep. And if there's a way to giveth, there should be a way to taketh away. It should all be documented.
We're going to have to make posters with that one now. So the attacker gets in and spends 2 days exfiltrating files that had patient data in it. Then they deployed the ransomware, the standard ransomware approach. And then they went, oh my, we can't do anything. Which is how, we discover ransomware is when everything gets locked down. That's when you discover it. Or you catch them in the act and you're trying to prevent it, which I've seen that happen. You're fighting them because you did catch them, but you got to fight them. So the data was already gone by the time they discovered it. And then they learn about the ransom that demands. And the thing is, the data they already sent in a screenshot of patient data record proving they had it. And they didn't investigate whether the attackers had accessed the database, even though the screenshot had information on 34 patients that the attackers provided. And the information that contained information only found in the patient database. But they didn't do any kind of investigation into that. And the screenshot likely reflected data in an actor-controlled database EMR record. So they're saying, we know we got a screenshot, probably of the EHR. So that we know they were in there. And they found that out in their investigation. And then here was a big one. They put in there that, so if you go, it's like always, you got the announcement and then you got the legal document. You read the legal document, you get so much more information. And that's where we got most of this. But they had done a security risk analysis when they said, have you done one? Yes. Everybody's good with that. When were your last ones done?
That's proprietary information.
I don't need to tell you that. They called in an external vendor that didn't even do it themselves. So, they're bringing in help in March 2017. They didn't have another one 4 years later, over 4 years later, when they were hit. They still hadn't done it. So after that point in the details of the findings, there's a whole bunch of mentions of deficient areas of their data security program. Because if you don't do that, it's just like we always say, if you don't do that right, everything else is built off of inefficient and incorrect and incomplete data.
Yeah. If your foundation's bad, the rest of it won't stand.
Not very well. So as part of this, they had to pay $450,000 in penalties and costs. So I like the fact that they are having to pay costs for the investigation because that makes sense. I don't know that OCR does that because they don't break theirs out. But then it was invest $1.2 million to strengthen the cybersecurity. And they say they would suspend $100,000 of the $450,000 they have to pay now when the company spends $1.2 million to develop and maintain the program. So if you could prove you spent the $1.2, we'll give you $100,000 back, basically what it is. Or they'll hold, you pay us $350 now, and you don't have to pay us the last $100,000 if you can prove all of this. So they're trying. They're trying. But it also specifically requires them to do specific elements of a cybersecurity program. And you know what they sound like to me, David?
Probably sound like HIPAA.
They do. They do. Maintain a comprehensive information security program designed to protect the security, confidentiality, and integrity of consumer information. That sounds familiar. Implement and maintain policies and procedures that limit access. Require multi-factor authentication to remotely access resources and data. Regularly rotate credentials that are used to access resources and data. Conduct audits at least semi-annually to ensure users only have access to resources and data necessary for their business functions. So all of you who say, well, we do it every 2 years. Just saying.
They got the number in the wrong place. It's twice a year.
Yeah. Encrypt all consumer information, whether stored or transmitted. That one gets tricky. Because they made a point of saying the data wasn't encrypted where it was stored. But even if it had been encrypted and they had administrator rights.
Yeah, they're accessing the data in an unencrypted state. So.
Right. But the fact that it wasn't encrypted, and so all the people who say I don't have to encrypt a server, be prepared to document the fact that you are protecting it with physical safeguards. My guess is there wasn't a lot of, it's clear there wasn't a lot of documentation about any considerations of that. So just make sure you're able to document it. Implement controls to monitor and log all security and operational activity of the company's network systems and develop, implement, and maintain a comprehensive incident response plan. Nothing in there would not be part of HIPAA.
Yeah, nothing's new.
So basically they're saying follow HIPAA. That's just the way it goes. Now, the reason that I said that the New York AG's office is doing a bit more, and I think we covered maybe one of these, because, it's hard for us to keep up with so much stuff.
Yeah.
Us meaning me. That was funny for me. All right, so yuck. All right, so this one is November 8th. They got a $450,000, again, the penalties and fees for U.S. Radiology. The settlement gives you all the details. And again, this is one where David really paid attention. And I was like, really? This is what, okay. So here's your lessons learned that you can use anytime people want to put off solving problems when there's a known vulnerability. So let's just start with that.
Mm-hmm.
And again, we have links to all this stuff in the show notes, so you don't have to go look for it. You can just find it. The delay, so they found there was a sonic firewall, which at one point, you don't use those anymore, but do you? I don't know.
No.
But a lot of providers, a lot of IT providers, they use sonic wall. I'm familiar with it. So are you. They had announced in January 2021, there was a known vulnerability found, and they announced that the particular ones that they had installed at Winsong Radiology Group, who is a partner of U.S. Radiology, who provides those management services. It's one of those management service groups. So it had a known vulnerability. They were like, okay, this one's end of life. We're, the firmware, we can't get there. It needs to be replaced. Great. But that got put off. They said in January, well, we're going to do that in July. And it was, as they mentioned, it was resources and financial and all the normal reasons that you put stuff off. Except for the fact that it has a known vulnerability, which apparently was not considered at all when they postponed the July implementation. So they know in January the device is a problem. They postponed the July implementation and apparently never rescheduled it. They're just, boom, we're out. And somebody better get to it later. And I'm sure it just got bumped off somebody's list. That was unfortunate because on December 8th, they still hadn't done it, and attackers were able to sign in to the VPN built into the firewall and take over all kinds of things from there. I mean, once you get into a firewall, you can find your way around everything. Isn't that a fair statement?
Yes, it is.
That's the keys to the kingdom. So they got 198,260 patients were exposed, just under the group that was the Western New York group, Winsong Radiology Group. This is the only group that we're talking about, not the entire thing. Don't know if other U.S. radiology groups had the sonic wall. This is specific to them. Maybe. Again, not one I've tracked. Don't know it, but may come up later. So when that happened, it was another one where they did it. They got the 450,000. They got the commitment to do better. So that's November. They did that one. October, they did another one. Long Island Home Health Care Company. Okay. Home health care. All you peeps who think it doesn't matter. We can't do this. In January 2021, a Personal Touch, which is the name of the home healthcare company on Long Island, employee opened a malware-infected file attached to a phishing email that allowed a hacker to gain access to the network and collect patient and employee records from an unencrypted server. And by the way, these records dated back decades.
Oh boy.
It's not pretty. So they agreed to pay $350,000 in penalties to New York, update and improve their cybersecurity infrastructure, offer free credit monitoring identities, which, by the way, in all of these, the New York AG requires you to offer free credit monitoring identity theft services. But this one I thought was a little interesting piece, and it doesn't go into details about it. But in addition to that $350,000, the Attorney General secured $100,000 from an insurance software vendor for compromising personal touch employees' data. So I'm wondering if they're like self-insured or something, or I don't know. The insurance software vendor part, that's something we need to go look into, but that was a rabbit hole I knew I didn't need to go down while I was doing these notes. Because we both know what that means. So that was October. So we have one in October, November, and January coming out of the AG's office. Prior to that, they had May 2023. Now, this one is another firewall one. In January 2019, Practice First had the firewall provider released a new version of the software, but they never installed the update and never did penetration tests, vulnerability scans, any kind of security testing. So from January 2019, vulnerability was found. Nothing between January 2019 and November 2020. So we're talking almost 2 years. Was done to fix the software and the firmware that they had for their firewall. So no one looked at that firewall in almost 2 years. And what's your policy for managing the firewall software?
Well, we log into the firewalls, depending on what they are. Most of them we have all in the same platform, so we can manage them all. So we don't have to go to each one of them. So we're able to look at them constantly, but we look at them typically monthly. Honestly, it's more often than that usually, but every single month we have to go in and look at it and make sure everything's up to date. We make a list of any things that are upcoming, especially if it's end of life stuff, like some of these folks we just talked about, because I want to have these conversations early on. And for a lot of our clients, we don't even sell them the network anymore. We lease it to them because I don't want to even have a conversation with them about, it's time to update. Well, we don't have the 5,000. Forget it. We're just gonna lease you the network, and when it's time to replace it, I'm just gonna buy a new thing, replace it, and that's it. We're not gonna have a conversation. So that's been beneficial for us, and I think for our clients too, because we don't have to have those conversations, and we can just do the work.
Well, that was a big thing for going to the cloud. That was a big piece that of anything. And I don't think people realize that the vendors for these IT products, and even if you have an internal IT team, if you have an internal team, you're going to have several of these networking devices, and all of them need to be up to date. I mean, just in my little home, it's a prosumer network. It's not a home network. I'm not even going to try that, but we got the router from AT&T Fiber, and then I got the router that is my Unify, and then there's all these other devices, and they're constantly being monitored, and I get notices, hey, this needs to be updated, it was updated, blah, 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 all this is happening. So, 2 years. 2 years, no one looked at that? Anyway, in November 2020, a hacker exploited the critical firewall vulnerability, successfully gained access to Practice First systems, then deployed ransomware. After they had pulled all the files off, they exfiltrate first, and then days later, screenshots with the personal information of 13 patients were discovered on the dark web. that's not the way. That is not the way. So they showed that they stole 79,000 roughly files with over 1.2 million patients in there.
Wow.
And of that 1.2 million, 428,000 were New Yorkers. So those are the people that are dealing, they were represented by their AG. And here's where the trick gets in. So let's say, New York and Connecticut. So now Connecticut's AG could go and do the same thing with Practice First and in their rules. And, this is why we need a federal standard, but I don't think we're ever going to get there. So they agreed to pay $550,000 in penalties and then, of course, strengthen the credit monitoring and all of this kind of stuff. And so that goes back to May. And then there is in April where they released a guide, a data security guide for all businesses on how to better protect consumer personal information. So if you're a small business, any kind of business, we got a link to this. That guide, it's got some pretty good stuff in it. So, anyhow, that leads us to the proposed cybersecurity requirements for hospitals in New York State. And this is one where you looked it up while I was doing some other stuff. You want to take us through it?
Yeah. So this is where the governor has announced, and I hope I don't get it wrong, it's Governor Hochul.
Yeah. We found
All right. There's a proposed cybersecurity regulation for hospitals in the state. So what they proposed, is it a he or she? I didn't look that up.
She.
So the governor, she has proposed for the fiscal year of 24, a budget that includes $500 million in funding for healthcare facilities to be able to upgrade their technology systems to comply with the proposed regulations. Now, interestingly enough, as we said earlier in some of these other things, a lot of this is going to sound like HIPAA. But there are some differences. Now, the governor did have a quote here I wanted to read, and she says, "Our interconnected world demands an interconnected defense against cyber attacks, leveraging every resource available, especially at hospitals. These new proposed regulations set forth a nation-leading blueprint to ensure New York State stands ready and resilient in the face of cyber threats." So, absolutely standing ovation for her recognizing how important healthcare is and doing something about it.
And the leading blueprint.
The nation leading blueprint is something that everybody else needs to kind of take note of, because this could be something that gets rolled out in an area near you.
Yeah, we touched on it briefly in a recent episode. The two things I pulled out were that it requires a CISO and a 2-hour from discovery reporting period of a cyber attack.
Yeah.
Cyber incident, and it defines those.
Mm-hmm.
There's some other stuff in there. It applies to general hospitals licensed in the state, but it doesn't mention the other entities.
Yeah.
And this is a proposal that's out on the New York State Register with some details. It points to the law, the proposed regulations, so on and so forth. But the net of it is, that's a big question that you will probably see in the responses to the notes of the hospital saying, well, if we have to do it, but then these smaller, you're going to see that division happen with the entities that connect to the hospital. It's part of the whole big picture, because hospitals will be required to establish policies and procedures for evaluating, assessing, and testing the security of externally developed applications used by the hospital. Ow.
One of the areas I thought was interesting, and you highlighted it here, was talking about the cost conversation about how much it costs estimated to start your cybersecurity program and to keep it going.
Yeah, they did go out and talk to a bunch. Like, there's a list of all the different health systems and hospitals that they talked to get this. And let's see, after their initial conversations, gaining a basic understanding of what this cost, it is estimated that effective cybersecurity programs can cost millions to develop and implement initially. Now, we've talked about that. It's important that you know that going in, it's expensive, but then you have to maintain it.
Mm-hmm.
It's two different things. And I don't remember which one of those ones we were looking at. Maybe the recent one where it was a list of all these things that they did. It was the one that hadn't done anything since 2017. And within the first few months, they had to do all of these things. And it was super, super expensive to implement all those things at the same time.
Mm-hmm.
You wouldn't have to do it within 30 days. If you do it, like build a plan and do it. But then they looked at it and said for small hospitals, they said there are 15 in New York that have less than 10 acute care or ICU beds. So that's what a small hospital is defined to them. The ongoing costs are estimated between $50,000 and $200,000 a year.
Yeah, sounds reasonable.
Yeah, sounds about right. Medium size, there's 62 of those, and they have between 10 and 100 beds total. And they estimate $200,000 to $500,000. Now, granted, these are New York numbers, where things are a bit more expensive, but still, it's not that different. And the small hospitals are in more rural regions. That's why they're small. And then, of course, the large ones, it's ongoing annual cost of about $2 million. Just for the cybersecurity.
Mm-hmm.
Effective cybersecurity programs. That's maintaining them. So there's some to go look at compare yourself to, I guess.
Yeah, and if you are a small provider, independent provider, don't let that scare you. You still need to go out and get quotes and understand what that looks like for you. We're not saying that because you've got 10 computers, it's going to be $50,000 a year.
Right.
So go out there and see what those numbers do look like. Depending on your size, $50,000 a year is about accurate when you start figuring in everything that comes with it. But chances are, if you're very small, you're not paying that.
Well, and again, you got to realize this is $50,000 to maintain the entire program.
Right.
It's IT.
Yep.
Two different things, probably three different things. You got IT, you got cybersecurity, and then you got the program management, governance, training, monitoring, documenting, all of that stuff. I'm number 3.
I think you're number 2. But anyway. But yeah, go do that. Cause I know a lot of the smaller guys, they don't even want to, I don't even want to get a quote cause I know I can't afford it. Well, don't assume cause you got to do the work either way. And so figure out what that's going to look like for you.
Yeah. I think that we're reaching the point where people are starting to understand cybersecurity is not a luxury.
No.
It's not a luxury item. It's a necessary item today. And cybersecurity and IT are not the same thing.
Yeah. I like to say it's like insurance because nobody wants to buy it, but you all need it.
Yeah, cybersecurity, definitely. At least with IT, you feel like now I can be more productive or I can offer a new service.
Yeah.
A lot of those things. But for the most part, I don't need to pay this much to keep my systems up and running. Well, let them go down. See how you do then. Test it. Test the theory of how could you operate it, and it'd be good for you because that will help with your incident response plan.
When you suggest that, people are like, well, I can't do that. Well,
True.
then it's pretty dang good, important then, isn't it?
Yeah, I mean, operating a business today with no technology is, I mean, it can be done, but they're few and far between today.
Yeah. And on the flip side of that, if you're the type of person that says, everything runs great, we don't have any problems at all, I don't know why we need IT. Okay. As you can see through some of these stories we talked about, things were probably running great. So good that the hackers were able to get in without issue.
No one noticed.
So, yeah, just because everything's running great doesn't mean things are great.
Yeah. That's the unfortunate thing.
Yep.
And you get that. Oh, we don't have to call you ever.
Yeah.
There's a reason. I take care of it before you need to call me.
Yep. It's like, as you've said before, it's the beautiful swan on the lake, It's like you're just seeing me just coast along, not doing a whole lot. But up under the water, man, it's just hectic. It's going nuts. There's all kind of activity happening.
Yeah, boy.
Yeah. If you want me to help you take your business forward, somebody's got to do all the paddling under the water, and that's what we do.
Mm-hmm. You want me to get it done quickly? That's one thing, but I'm still paddling more. I'm just making faster waves. But if you notice, those little ducktails and swan tails do move.
That's right.
All right. There you go, buddy.
All right. That is our show for today, folks. Thanks for listening. Be sure to share us out on your favorite social media site and rate us, and go check us out on YouTube. We appreciate it. And as always, remember, the HIPAA is not about compliance. It's about patient care.
Help me with HIPAA. Let's get it right. Protect your patients day and night. Donna and David, the experts on your side. Help me with HIPAA. Let's get it right.
You've been listening to the Help Me with HIPAA podcast, hosted by Donna Grindle and David Sims. The show created to help you with HIPAA. For more information or to ask us a question, visit our website at helpmewithhipaa.com. Neither Donna Grindle or David Sims are attorneys, and they do not offer binding legal advice concerning regulatory compliance. The information in this podcast should not be relied upon or construed as legal advice in any way. Consult your attorney for legal advice concerning compliance with HIPAA regulations.